Cinque. I am one of the therapists here at the Reclaim Collective, and today I wanted to take a couple minutes to introduce myself, tell you a little bit about me, my style as a clinician, and also answer some of my most commonly asked questions by new clients to hopefully let you understand a little bit more about me and kind of how I practice, but hopefully make your search for a new therapist a little bit easier, because I know that there's a lot of options out there and it can be really overwhelming. I'm a licensed professional counselor in the state of Pennsylvania, and I also have my certified trauma professional certification. I got my bachelor's degree from Albright College, which is a super small liberal arts school in Reading, Pennsylvania, and my master's degree in clinical and counseling psychology with a concentration in trauma studies from Chestnut Hill College in Philadelphia. I graduated with my master's in the spring of 2020, and my first job out of school was as a therapist at an inpatient rehab. So I was one of two therapists in their women's trauma unit. So I do have a background in substance abuse treatment. And I did my internship while I was at school at a group home for adolescents, and did a lot of treatment of trauma there. So also have a background working with adolescents as well. But I knew ever since I was in my master's program that I did want to land in a position where I was able to work with folks who were dealing with eating disorders, disordered eating, breaking down diet culture and the influence that diet culture had on them, and also work to kind of heal the relationship with their bodies. So about a year after I graduated, I finally got the opportunity to transition to a role working as a primary therapist in a PHP program that focused on treating eating disorders. So while I was there, I worked with individuals who were struggling with anorexia, bulimia, binge eating disorder, avoidant restrictive food intake disorder. I did individual therapy and group therapy while I was there, and I absolutely loved it. I knew right away that it was where I wanted to be in my career and kind of the people that I wanted to be working with. I found it super fulfilling. But I knew that I eventually wanted to get into the private practice world as well. So I was at the PHP program for about 2 years, but about a year in, I found Reclaim and reached out, and I've been a part of the team for about a year and a half now. One question that I get a lot is where my interest in becoming a therapist came from, and specifically why I wanted to get into the field of working with individuals who are struggling with their relationship with food and their bodies. So I can remember I took my first psych class when I was in high school. I think I was like a junior in high school, and I remember loving that class. Like, I looked forward to it. It was my favorite class. I thought it was just so fascinating. So that really sparked my interest in the field, and that continued into college and obviously well beyond. But I also knew as I got a little bit older that the mental health field is so important, and I wanted to be able to work in a space where I could help people, and particularly help people with their mental health, because I've had my own journey with my own mental health, and my own relationship with food and my body. I think it's been helpful and impactful being able to be open about my own journey in recovery with my clients, because at the end of the day, I do know how hard it is, and I want my clients to know above anything else, when they start working with me, that recovery is possible, and it is possible to have a different relationship with your body, have a loving and caring relationship with your body, have a a normal relationship with food, to reclaim your mind and the thoughts in your mind, because I know that at times it feels impossible, because it is so overwhelming. So I do get asked a lot as well, like, what is something that I want clients to know coming into this work? And it is, at the end of the day, that it's possible, even though it's hard. I also want clients to know that diet culture sucks, and it is a multi-billion-dollar industry that wants to stay that way. And they are going to do whatever it takes to make sure that people stay engaged. So a lot of times I see people coming in who have a history of dieting, a history of, doing different programs, whether it's a dieting program or a workout program, that are just so frustrated and beating themselves up because they feel like they're failing. So I also like clients to know you are not the problem. They are designed to keep you stuck. And I think that that's really important to be able to break that down and name that, this kind of work, working on relationship with body and relationship with food is already rooted in so much shame, and diet culture kind of piles that on. So I think it's always really important to point out that, again, you're not the problem. Another question I get asked quite a bit is what my style is as a therapist. So sometimes that does look like asking me if there are specific schools of thought or different theories that I use a lot in sessions. And overall, I do consider myself to be a pretty eclectic therapist. So there are definitely ideologies out there that I do like and think are really helpful. So I will bring mindfulness-based work into sessions, dialectical behavior therapy, acceptance and commitment therapy, cognitive behavioral therapy. And I've recently started to do a lot with internal family systems and parts work. So I absolutely think that those things are valuable. But I would say overall, the biggest thing that I like to highlight about my personal style is that I'm very strengths-based, meaning that I like to meet my clients where they're at and kind of pick out what the strengths are innately that already exist where they're at, that they can use to help work towards the goals that we set in our work together. I also think that it's really important to point out the successes and the wins, because I think we need to prove to ourselves, like, oh, I am doing the work. I am capable of this. I think sometimes it's so easy to get caught up in how hard things feel that we really need to take a step back and acknowledge, like, this was a win. You are doing it. I hope that these questions were helpful, and gave you a clear picture of who I am and some of my interests, as well as my own journey and who I am as a therapist. But I want to thank you as well for being here and taking the first step to seek out therapy, because I know that step can be really difficult. So I just want to acknowledge you for taking that step, and I would be honored to be a part of your journey.